Good morning. CDC is proud to again be part of World Thrombosis Day. This global effort highlights the often overlooked, underdiagnosed, and misunderstood disease of thrombosis. As you know, thrombosis is a leading cause of death and disability worldwide. This year's focus is healthcare-associated thrombosis and the need for routine assessment of all hospital patients. Many people may not realize that thrombosis is an underlying condition that can lead to the top 3 causes of cardiovascular death: heart attack, stroke, and venous thromboembolism, or VTE. VTE is a serious and apparently growing public health problem that refers to blood clots occurring as deep vein thrombosis or pulmonary emboli, or both. More than half of VTE events are associated with a recent hospitalization or surgery. VTE is a leading cause of preventable death in the hospital. It's estimated that there could be up to 900,000 VTE events each year in this country, resulting in as many as 100,000 premature deaths and healthcare costs as high as $10 billion a year. Anyone at any age can develop VTE, but some people are at higher risk. Patients who are currently or recently hospitalized, recovering from surgery, receiving cancer treatment, or on bed rest have an increased risk. Among patients with cancer, VTE is a leading cause of death. Fortunately, prevention steps such as anticoagulant medicine and compression devices can reduce the chances of developing a blood clot. Complications and death from VTE can be avoided with early and accurate diagnosis and effective management. To address this, in 2015, CDC launched the Healthcare-Associated VTE Prevention Challenge to recognize hospitals, managed care organizations, and hospital networks that have implemented effective, sustainable VTE prevention programs. 8 champions were identified, ranging from single hospitals to large multi-hospital networks. Strategies that these champions used illustrate the importance of routinely assessing every patient's risk for VTE, using electronic health records and clinical decision tools, prevention strategies for those at risk, and improving education and awareness for both patients and healthcare providers. These champions show that evidence-based prevention strategies can be implemented across a wide range of hospitals and health systems. We can learn from their efforts and hope that others can learn and be encouraged by their progress. CDC is working to better understand the causes, burden, prevention, and outcomes of VTE in order to reduce the burden. We encourage every healthcare provider to routinely assess the VTE risk of every hospital patient and take action by implementing prevention measures. We also have to recognize that as much progress as we've made, as many useful prevention tools as we have, these aren't enough. Even with good adherence to assessment and prevention, too many patients will develop VTE. For some, the hospital bed is the culprit. Getting patients moving safely as soon as humanly possible is one way we may be able to further decrease VTE. For other patients, we may need better ways to reduce clotting without increasing the risk of bleeding. And we definitely need more practice-based evidence. Healthcare systems that vigorously and rigorously try new strategies, such as immediate mobilization of patients, and evaluate outcomes. Thank you for your time, your interest, and your commitment to keeping patients healthier and safer. Together, we can reduce the global burden of thrombosis.